Okay, this is a research question presentation. On today's discussion, we're going to be going over the background and relevance, the lenses, the research question, and the works cited.
For our background and relevance, first we have the definition of sugar, which is a simple carbohydrate naturally found in things like fruits and milk and added to processed foods like sweets and soda. Another fact is that adolescents aged 12 to 19 consume an average of 20 teaspoons of added sugars daily, which exceeds recommendation limits by the CDC. Lastly, consuming too many added sugars can contribute to health problems such as weight gain, and obesity, type 2 diabetes, and heart diseases. This leads us to our question of to what extent does sugar intake impact adolescents' growth in America?
So next is our lenses, and the lenses that we chose to do were the social and cultural, economic, political and historical, and the scientific lens. So leading into our perspectives, to start, the economic lens. So our first perspective is that consumers, families spend more money on doctor visits and medicine when teens eat too much sugar and get sick. For the second perspective, our economics. Treating health problems caused by sugar costs a lot of money for everyone, including the government. And for the last perspective within the economic lens is manufacturers. Companies that sell sugary snacks and drink make a lot of money from teens, but rules to cut sugar could hurt their profits. Regarding the social and cultural lens, the first perspective seen involves teenagers. Peer pressure and social trends encourage adolescents to consume sugary snacks and drinks. So this highlights how the social behaviors and cultural norms shape their dietary choices. Second, advertisers and media influencers. The online portrayal that is seen nowadays of sugary foods as trendy or appealing can reflect the cultural impact of digital media and advertising when it comes to normalizing and glamorizing unhealthy dietary habits among teenagers. And for the final perspective, parents and caregivers, it is important to notice that parents' socioeconomic status and nutritional attitudes illustrate how cultural and social factors within the home environment influence adolescents' access to and consumption of sugary foods.
Next, we have the political and historical lens. First, we have the perspective of a public health lawyer, which is when we see that they advocate for policies to regulate things like sugar consumption among adolescents, which addresses its impact on their growth and long-term health. Next, we have the perspective of pediatricians, which monitor how excessive sugar intake affects these adolescents and their physical growth, development, and risk for health issues like obesity and diabetes. Lastly, we have dietitians and nutritionists. This shows how they educate adolescents and their families on the importance of reducing sugar intake to support healthy growth and a balanced nutrition.
Relating to the scientific lens, the first perspective is pediatricians. Children's doctors that know their previous health conditions could identify obesity or poor growth patterns. The next one is parents. Parents often observe the immediate effects of sugar consumption, such as hyperactivity or mood swings in their children. Lastly, we have psychologists who study the relationship between sugar intake and mental health, including its potential role in mood disorders and addiction-like behavior.
The first lens we're going to be covering is the social and cultural lens. So, peer pressure and social influence are factors that drive teenagers towards sugary snacks to fit in with peers and trends, underscoring the argument that societal norms heavily influence adolescent dietary habits. Secondly, parent socioeconomic factors and attitudes can determine the accessibility of sugary foods at home, which reflect how cultural and economic disparities can shape how adolescents grow and their health outcomes. Finally, the sugary food portrayals that are seen online are unrealistic and glamorized, which create a distorted perception of their desirability, reinforcing the argument that cultural forces perpetuate unhealthy habits among adolescents.
Next, for the political and historical lens. First, we have how government policies and agricultural practices affect them. Through history, historical decisions such as different decisions for sugar production have made sugary foods more affordable and accessible. This shows how they influence adolescents' dietary patterns and can change their growth outcomes. Next, we have how political movements and public health campaigns affect them. This shows how efforts taken by our country to regulate sugar consumption, like advocating for sugar taxes or educational campaigns, aim to protect adolescents from the negative effects of excessive sugar on their physical and cognitive development. Lastly, I have how food industries lobby against sugar regulations. This shows how the resistance from food industries have delayed the measures that can help adolescents make informed dietary choices, which changes the impact of high sugar consumption on their growth and their health.
So now for the economic lens, the first point are healthcare costs. High sugar consumption can lead to various health issues, including obesity, diabetes, and dental problems, which require medical intervention. For adolescents, these issues can become chronic and necessitate long-term healthcare solutions such as regular doctor visits, medication, and treatments, which burden families and healthcare systems financially. Next is the economic impact on the food industry. The food industry thrives on the demand for sugary products such as snacks, beverages, and processed foods. Manufacturers benefit financially from marketing and selling these products, especially to younger demographics like adolescents. If policies were to limit sugar consumption through taxes, labeling, or restrictions, it could reduce the profitability of these companies and impact their economic stability. And lastly, the accessibility of healthier alternatives. Low sugar or healthier food options often cost more due to higher production costs or niche marketing. For low-income families, this creates a barrier to accessing these alternatives, making sugary and processed foods more appealing due to the affordability.
Now, for the scientific lens, we see how sugar intake could affect an adolescent's cognitive development, which could affect their adulthood. This could affect their memory and learning abilities and is linked to symptoms of anxiety and depression. Next, we have the actual physical development of a child, which could be negatively affected because of weight impact, bone growth. Bone growth later affects the overall development of an adolescent when going into adulthood. The risk of chronic disease also becomes a possibility, such as diabetes or high cholesterol. Sugar intake also causes behavioral changes in adolescents, such as hyperactivity, mood swings, and impulsivity. Changes in intake could cause glucose levels to fluctuate and later affecting the adolescent's activity. Some ongoing points of debate are that advocates push for government-imposed sugar taxes and restrictions, while opponents argue for education and personal choice instead. Another point is whether natural sugars are less harmful than added sugars, or if overconsumption or any sugar is equally detrimental towards adolescents. Lastly, researchers debate whether high sugar intake directly worsens mental health issues like anxiety, depression, and ADHD in adolescents.
Lastly, for anticipated judgment, first we have the question on would sugar taxes and educational campaigns truly be effective in reducing adolescent sugar consumption and improving health outcomes. Next, we have the question on do sugar-related policies disproportionately impact low-income families who may have less access to healthier alternatives. Lastly, we have if there is enough evidence linking sugar consumption to long-term development and mental health issues in adolescents to justify stricter regulations. This is our works cited, and that's it.
Thank you.